It's been an awesome liposuction day, changing lives, making stuff happen. Hope everyone's having a great day. Thursday. It's always a good day on Thursday. So today I'll be answering some questions on liposuction, fat transfer, laser skin tightening through smart lipo. Sorry, I'm just trying to figure this out here on YouTube. So we're live on Facebook, YouTube, and Instagram right now. If any of you guys want to go check out other channels. Okay. All right. Hey, Ron.
Yes, sir.
Don't put that, just put the message.
Oh, sure.
All right. And if you guys can take a look and see. So I'm going to try and go through these questions, but as I said, we're live on a bunch of different channels, so I'm probably not going to get to everything. So I apologize right now if I miss anything, but I will try to keep up. But it's kind of hard for me to read and talk at the same time, so I'll do my best. What's up? Chicago's in the house. Mecca love. Okay. So today was, okay, so like this week has been like a 360 lipo week for me. In let's see, 2 days I did 6 procedures that were 360 lipo, forming waistlines for people that never thought it was possible. So particularly larger individuals, you know, if you're a larger individual and you know you've been turned down from other doctors saying that they can't do procedures on you, or you know you have to lose weight before you get any procedures done, it's not true. I suck fat for a living. I suck a lot of fat out of people. So if you have a lot of fat and you want it sucked out, My Shape Lipo is the place to be. Let's see. There's a comment on YouTube from Rainy Waters. It says that you've been calling to set up your appointment and that we must be busy. It drives me crazy that people say that we don't answer phones sometimes, or it's busy, or whatever the case. But I can tell you, we do have issues with phones, and it sucks. Cox phone sucks. Their internet sucks too, and we've been dealing with it for years. So I apologize. Sometimes things happen. So please keep trying. That's all I can say. Please, you know, keep calling, keep trying, keep doing whatever you can do to get through to us, because obviously your business is important to us. But more importantly, if you really want to get this procedure, you got to put forth the effort and do whatever is necessary to get it done. So 360 lipo is awesome. Now, I just want to say, for one thing, I had a couple men this week, and both of them described how they believed that men don't get liposuction, and I want to say that's a complete myth. I've personally had liposuction, and about 30% of our patient population are men. So it is absolutely possible, and men do get liposuction. They just don't talk about it. You know, like we don't show a lot of pictures because guys don't come back, you know, unfortunately, and they don't send pictures. They don't talk to other people about it. It's like they create the, you know, the belief that only women get liposuction. So if you struggle with fat, liposuction is awesome. And you can see from these pictures, I'm going to, you know, sit back a little bit so you can see this. I mean, like, very large individuals are getting liposuction and getting phenomenal results, and it's awesome how you can see how the belly's hanging over here, and after liposuction, that hangover portion, that pannus is what we call it, it can completely go away. Now, I don't want to blow smoke up your ass and saying that everybody gets these results. However, a large majority of people do. So where you get phenomenal, consistent results, and like if you got the problem and you don't like it, then fix it. It's that easy. It does cost money, so we don't do everything for free. Although we do have some free liposuction contests, but not everything's for free. So if you want this done, it's totally worth it. Whatever it costs, our costs are less than uh, pretty much anyone. I don't, I haven't been cost shopping recently, but I know a lot of patients tell me that when they search, they've gone other places. Uh, they they're still saying that our quotes are substantially lower than everybody else's. So, um, we have very good affordable rates. With that said, this is a business. We do have costs and expenses, so we have to make money. Unfortunately, I can't do all this stuff for free. But it really just for me, like I love doing what I do because it really makes such an impact on the individual's lives, and it helps them to have the confidence to do the things that they want to do. And I mean, could you imagine being this lady here, and she's like, this is restricted. It restricts the movement. Your ability to um, just bend and move and it's heavy. Like imagine if you had a 25-pound backpack and you're carrying it around all the time. I mean, that's what a lot of these people are doing all day long, and you don't even realize how much of a benefit it would be to just drop that backpack. I mean, in one day, it's gone. Like we were able to remove a substantial amount of fat, and it's gone. And it's just like the proverbial a weight lifted off your back kind of thing. But it allows you just to live your life, and whatever it costs, I promise you the value is there. Because feeling better, being able to do things that you feel restricted to do now, having the ability to do things is you can't really put a price tag on that. I mean, we do put a price tag on it, but you can't really put a price tag on it because the reality is that it's going to change your life and it's going to make a huge impact on your life forever. You know. So D Robinson, you said you're scared that you won't look right due to the large stomach and the panis. I mean, just look at some of the pictures that we're putting up now. We have very large individuals. I don't know what you look like because I'm looking at this on YouTube, but you know, it's I can't promise anything. Look, but we can make huge dramatic change to people. Everybody's different. So, you see these pictures and their before body looks different than you. It's always going to be that way. And there's like just because we have an amazing pictures, amazing reviews, amazing whatever. People like us. They think that we do great work. Just because of that doesn't mean that you're going to get the exact results that you're looking for. Just because one person got the results doesn't mean that you're going to get them. So people have to be realistic with their expectations, and I think that's sometimes um, you know people get carried away with looking to see how other people have done. I mean, even anywhere you look, I mean, any other plastic surgeons or liposuction specialists that you're looking into, anybody that's doing work like this, the truth is that you can't guarantee anything because there's so many variables with the individual, like the skin elasticity, the quality of the fat. People have different quality of fat. Sometimes the fat comes out easy, and sometimes it's extremely difficult. And you can't I can't tell you that you're gonna have difficult fat before I get started. It's like we have to get started. We have to do it. We have to get in there and start sucking the fat out. Either it's easy or it's not easy. But there's no way to know for sure beforehand, and there's no way to know exactly what the outcome is going to be until we actually do it. So there's always going to be some type of risk involved in any of these procedures that you consider doing on your body for cosmetic purposes. So you just got to keep that in mind. Um, Fat transfers are great procedures. Fat transfer, people also call that Brazilian butt lift when you transfer the fat to the butt. Um, but we also do fat transfer to the breast. Awesome, awesome procedures. Did one of those earlier today. Okay, so Kathy Epler says menopause weight gain is real. Is lipo reasonable solution and the recovery time? So Kathy, look, people gain weight for lots of different reasons, but you're right. Menopause with the changing of hormones, definitely you get weight gain from that, or you can get weight gain from that. There's people that gain weight from the use of medications like steroids, um, and there's a number of other medications on the market that cause weight gain. So yes, the short answer is yes. Liposuction is a great option for you, and it's just a matter of, do you have fat? It doesn't matter how you got it or how quickly you got it or how long it took you to get it. Like, none of that stuff really matters to me. It's just the fact that you have fat. If you have fat, you want to get rid of it, then that's liposuction is, you're a good candidate for liposuction. Now, recovery wise, everybody's a little bit different. We do keep statistics on this, so I can give you some guesstimates, some round numbers. So typically, as far as the fluids that we use to get you numb, you're going to be draining some of these fluids after the procedure. On average, people stop draining within 3 days. You're going to get some swelling after these procedures. Everybody's different. So some people, the swelling will go away fairly quickly. Other people, you may have residual swelling for months after the procedure. You're gonna have some bruising. Bruising is pretty typical. And the process of bruising going away. Typically, it takes about 2 weeks for bruising to go away, but everybody's a little bit different. But bruising is just simply blood underneath the skin that's showing through. And all it does, it's the process for it to go away is simply your body to reabsorb that blood, and the bruising goes away. Now, there are some things like arnica that can help speed up that process. As far as getting back to work and activities, typically people that have sedentary type jobs are able to get back to work within 3 days. However, not I'd say about 86% of people are able to get back to work within 3 days, a sedentary type job. But that leaves about 15%, 14% of people that don't get back to work within 3 days, which, so some people take longer just because perhaps they don't tolerate things as well, or they may just be more sore, or maybe they treated more areas, or if your job is more physical, then you may be a little bit more limited, and it may take you a little bit longer to get back to your work, if you have, hey, the screen changed. Um, it may take you a little bit longer if you have a physical job. If you're sore and you're aching, you don't want to get back to work. So everybody's different. But with that said, there's people. I mean, I have people that go back to work the same day. So I mean, we got awesome stories like that. But that doesn't mean that you're going to go back to work the same day. So just be realistic. Okay, Claudia Gomez asking Sophia if it hurt. Yes, Candy Lover was my patient. Let's see. Let's see. Can you explain a 360 lipo? Absolutely. Okay, so 360 lipo is essentially, it's liposuction all the way around the waistline. So we're trying to create an elongated hourglass figure. And so what that means is the waistline on most people starts up higher, because they've started to fill in the waistline. So what we want to do is lower the waistline and elongate those curves. So we treat on the sides down lower, on the sides of the butt, to start your waist down lower, to create that Coke bottle look. And we do this on large individuals too, which is freaking amazing. A lot of these larger individuals, they fill in so much fat around the waistline, and instead of going in, they're going out. So they have this kind of like this muffin top appearance, is what people call this. And we can literally take you from bulging out to sucking in. And the 360 liposuction goes all the way around the waistline. So everything on the front of the abdomen, from the breast to the natural endpoint, or the fold, or wherever it is at the bottom of your stomach. On the sides, we do the love handles, which are up a little bit higher. So there's a gap between your ribs and your pelvis. And so that's typically where the love handles are. When you take that out, that's where you get that curve, that accentuated curve. Then the hips are just below the pelvic bone on the side. If you can imagine where you would hold a baby, that's typically where your hips, what we consider the hips. So when you treat down lower, it lowers the entire waistline, so it creates that elongated waistline. So it's amazing. Now the other thing, the key component of the 360 lipo is treating the lower back. And when we treat the lower back, that's what creates that sway, that arch to your back. You know, a lot of people, um, as you gain weight, they start to fill in the fat all the way across the lower back. And what it does is we all naturally have a lumbar, a curvature to our back, from our spine. So all of us have it, unless, you know, obviously there's some people that don't, that have issues, but we're going to talk about normal people now. So everybody has that curvature to your back, but as you start to fill in with the fat, it starts to make your back more straight. So it appears that you're standing up more straight as opposed to naturally having that arch to your back. Now, when you do that, if you can imagine your butt's down below, you got a fat pad in your lower back, sometimes it's like 2, 3 inches thick. Um, that fat pad will make it look like it'll come out to about the distance of where your butt is, and then it'll look like your butt's flat. So the really cool thing about this procedure is when we take out that lower back fat, it sucks in a couple inches, but then it makes it look like your butt pops out. And so we don't even do anything to the butt, but it makes it look like it pops out. And it allows me to literally carve out and shape the butt, which one of my favorite things to do, treating the lower back. And the irony of this is that I literally, like, I'm always constantly trying to be the best that I can be. And I only started doing the lower back about maybe 3.5 years ago. So once we started doing it, I mean, the results were amazing. And then Candy Lover, or Angelica, we did her procedure and we treated her lower back, and the results were just like amazing. They're phenomenal. So she's really helped us popularize treating the lower back and the coining of the term, the 360 lipo. Let's see. So Kathy Epler asks again, the lower back, is that near the love handles? Is this part of 360? So the lower back is just above the butt, and it goes all the way across the lower back. So that's the area. And the love handles and the hips are on the sides, and that's going to create the curves on the sides. The lower back is key, though. It's really important. If you have any fat there, and it honestly, it doesn't really take that much fat to make a big difference. And I actually treated my wife. I treated her lower back, and she's not that big, but she had a little fat pad there, and we took it out, and it's amazing. Very happy. Um, see, we're having issues with the pictures, so we'll work on that. Okay, so if you guys have any questions, Stephanie, we are located in Las Vegas. Thank you, Rachel, for answering that. Okay. Lashavia, I hope I pronounced that right. Watley, how many procedures can be done at once? So I think you're asking how many areas can we treat at once. You know, it's between 4 and 6 areas. It depends on the individual, and this is a guideline. It's not a hard and fast rule. There's restrictions in the amount of numbing fluid that we can use, and the numbing fluid is a lidocaine, and lidocaine, like any other medication, has a toxic range. So if you use too much of it, it can become toxic. So we try to guesstimate at the amount of fluid that we would use for your procedure, and try not to go over those limits for safety purposes, because if you use too much lidocaine, it can cause issues like heart issues. It can cause seizures. So it's not good stuff. Certainly nothing that you want to risk for a cosmetic procedure. Claudia, I'm sorry, we're working on pictures. We do have pictures of the BBL. If you want to go check out our website after the live, you can go check it out there. We have lots of pictures. And hopefully we can get these pictures up behind me shortly. Tamika, is there another contest? So we have the ongoing free liposuction contest, which is a random drawing. When you enter the contest, we announce. We haven't announced when we're going to announce that the next winner. We've had 12 winners for that contest now. But so that's the liposuction contest. That's a random drawing. We also have right now that we're encouraging individuals to place their deposit. So to enter the contest, this new contest, you have to actually place your deposit, and you can either get your procedure or not get your procedure until later. But we're going to announce a new winner every quarter, in which we're going to reward these individuals for taking action and placing their deposit. We're going to reward them with one person is going to win 3 areas of free liposuction. So if you haven't had your procedure, we'll credit it to your procedure, and and if you've already had your procedure, then we'll reimburse you back the equivalent dollar amount. So we're giving people this. This is I don't think you guys really realize what this means. So the fact that we're requiring people to place a deposit, I've gotten some backlash, people saying that that's they don't like that. But the truth is that when when we limit it this much, the sample size of people that are being considered to win this contest is going to be substantially smaller. So when I say substantially smaller, oh, what happened? Something happened on our Facebook page. It says that the account is temporarily locked. What does that mean?
On my sheet?
Yeah. There's saying there's a. Here, you want to look at this really quick? I think someone logged in. One of us logged in. I don't know what should I say, yes or no?
Was this you? Please review the result and let us know it was you. Say yes.
Yes.
Yeah.
Okay.
Say yes. It was one of our guys somewhere.
Okay,
Must be,
continue.
you know.
Okay, we're back. All right, we're back. You're right. All right. I got discouraged. I mean discouraged. I got distracted here. How does the skin snatch back when you do lipo? So it actually retracts back quite nicely for most people. Now, again, I'm always going to discuss these answers are very vague for the purposes. The reality is everyone's a little bit different. But yeah, you can go back to that arm. So arm liposuction is, people will typically have looser skin, and you can see from this individual here. This is Tina Gray, right?
Yes.
So this individual had loose hanging skin on the arm, so a lot of times the arm hangs down. So typically on women, it's like it kind of hangs down here. And so the big concern is that you don't want to get liposuction if it's going to be have the like loose flapping skin afterwards. But here's the truth. You can see the answer right here. The skin tightens up quite nicely. And this is an individual. How old is Tina? She's like 53 or something like that. I don't want to do her wrong, but I know she's in her 50s. So she's got like as we age, all of us tend to get more laxity to our skin. So. But you can see she had loose skin before, and you saw how far it was sagging. You can see how far it's sagging down on the arms. And then afterwards, it's like it almost appears like we just like lopped off the skin, but we didn't. This is just liposuction. She also had laser skin tightening. The Smart Lipo laser can tighten the skin. Studies show you can get up to 57% more skin tightening when you use the laser versus liposuction alone. So if you're worried about looseness of the skin, it does retract back quite nicely. So Veronica Hunter, she asked, what are the rules of the contest? So the big thing with this contest is that in order to enter the contest, you have to actually place your deposit. So we're looking for people that are actually serious about getting liposuction and willing to pay for it. And if you're willing to take that risk, we are going to give you a great opportunity to actually win 3 areas of liposuction. Now, and as I was saying earlier, we substantially limit the sample size because we're requiring you to place a deposit. So that means that instead of 1 in 100,000 people, you're going to have a chance of like 1 in 100 or 1 in 75, depending on how many people get procedures in that 3-month period. So you know, if you want liposuction, this is the incentive. What we're trying to do is we're trying to get people that are kind of like sitting on the fence right now, and like you're thinking about getting liposuction, you're pretty sure you want it, and we're just giving you that little extra incentive. This is you'll have a good chance of uh, winning this contest and getting 3 areas of liposuction for free. But if you don't and you get your procedure, that's awesome too. I mean, you should be super happy. Okay.
Just kick me out so I can't see.
Okay, so I had okay. There's a Carmen Parham. She looks like she had her procedure in Miami from someone else. Like, first of all, shame on you. No, but she had a BBL done in Miami, June of last year, and she said that she's now starting to see dimples on her butt, and she didn't get rid of her stomach as much as it's not as flat as she'd like it to be. What can you do? So theoretically, these procedures can be done a second time. That's called a revision liposuction. This is the thing that kind of sucks is like when you go to someone that doesn't necessarily have the experience to do liposuction. A lot of these guys, they're not confident in what they do. So because they're not confident, they're not aggressive. And when you don't aggressively get the fat out, you're still going to have fat left behind. And if you still have fat left behind, over time, if you gain weight, you can gain weight right back in that same area. Now, the way to make sure that that doesn't happen is to be not overly, but to be very aggressive in removing the fat while keeping everything smooth and even. So that's ideal. And if you can get out the bulk of the fat, then you should never have to do this procedure again. And because of that, my revision rate is like less than 1%. So which means that I don't have to go back in a second time um, to fix or to get out more fat. My patients rarely ever come back to get the same area treated. If they come back to me, it's because they're getting other areas treated. Now, some people might say that that's a bad business move because you want people to come back and spend more money. But, I believe in, I'm doing the best that I can do personally, and the best that I can do is going to be the best for you. I treat everybody like I would treat my family members. So I wouldn't want my family members to get screwed like that. So I do the best that I can do so you never have to get the procedure again on the same area. So that would be the goal.
They keep asking if you're board certified. Is that what you were trying to answer?
No.
Or is it video?
Where is it? Where do you see that?
One says, in '97, I got I had a nightmare plastic surgery in '97. My first question, are you board certified?
Oh,
American
okay.
Plastic Surgeon.
Yeah, so I'm not a plastic surgeon, and I am board certified, but most people that are asking that question have no idea what that actually means, what board certification means. So I'll school you a little bit on this. Board certification is simply tests that you can take. They and it's I mean like everybody has to get some type of board certification. So you just take a test. Now there's no tests that are going to determine whether you're good at liposuction or good at anything like manual dexterity. You can't test that. So it doesn't really matter whether you're board certified. Now I know plastic surgeons okay, plastic surgeons, the American Board of Plastic Surgeons, just so you guys are aware, they spend millions and millions of dollars promoting promoting plastic surgery and saying that it's mandatory that you go to a board certified plastic surgeon, so you don't get screwed. So you've probably been programmed so much from their advertising that you believe that that's true, but the truth is like board certification is just a test, and there's no test that's going to test for manual dexterity and quality of the work that you do. You got to see the results. Look at the pictures. Talk to people. Talk to their previous patients. These are the ways that you actually figure out. Now, with that said, I mean, like I've done thousands of these procedures, And there's going to be some patients that they just don't get good results, and it's not necessarily something that I do. I mean, I have great technique, and I've done this thousands and thousands of times, and my results are very consistent. But with that said, there's some people that I'm like, I don't know what to do with them, because there's things that are so complex, like scar tissue and scarring. You got dimpling, you got looseness of skin, you got thin skin. Like there's so many things that can affect the outcome, that you can't guarantee that stuff, because I'll do the same thing on every patient, but each patient, you look at 10 patients and they're gonna all have slightly different results. Um, so you know to some degree, you're some people just aren't meant to have good results, and it's unfortunate, and I don't like saying that, but and you never know who these people are. So I as I tell people, like, I can't guarantee anything. All I can guarantee is that I'm going to do the best that I can do to get you the best results, and beyond that, you have to accept whatever you get. You're always going to be taking some risk, when it comes to doing these procedures, that things aren't necessarily going to turn out the way that you want.
Kenya asked, I've been saving up money to go to you. I do want to enter the contest, but I want to know how much do you have to put down?
Okay, so Kenya said, she wants to come to me, and she's been saving money, and she wants to enter the contest, so she wants to know how much to put down. So in order to enter the contest, as we said, you have to place your deposit. The deposit is 25% of your procedure cost. So the question is what is your procedure cost? And so that's going to be determined by what you want treated exactly. And to figure that out, the first step is getting your free consultation. So during your consultation, if you're local, you can come into our office and we can do the consultation in person. If you're not local, then we do our consultations over the phone, where you can email pictures in. We review the pictures, answer all your questions, and we can determine what you would need to treat, what areas you need to treat in order to get the results that you're looking for. So once we get the quote, then you can figure out what the 25% is and placing the deposit. So that's how that works. Anita Lopez says, "Do any doctors do pro bono cases?" I mean, you people that want free life, everything for free in life. I mean, like, look, everything costs money. Nothing's for free. So if I'm giving it away for free, it actually costs me money to give something away for free. So I mean, like, stop being takers. Like I'm giving away free stuff, and I'm offering this stuff, and I don't have to do any of this stuff. I don't have to give anything away for free. I don't have to do any of this stuff for free. Okay, but I do, because I care and I want people to have opportunities. But like, you can pay for your stuff. I mean, like, come on.
Amanda Borsina, how bad does it hurt?
How bad does it hurt?
No pain usually.
So my running joke with this is that it doesn't hurt me at all. No, but how much pain or discomfort you have during the procedure, it's variable. Everyone's different. The first part of the procedure, getting you numb, the numbing process, since you're not numb yet, that's the part that you feel. It feels kind of like a pinching sensation, and I'm speaking from experience here, so I can tell you it feels kind of like a pinching sensation. It's really weird. Men typically don't tolerate this procedure as well as women, and most of it, in the way I see it, because I've seen lots of men, a lot of it's psychological. Guys, they don't do well with weird stuff. Women tend to do better, just because they are used to weird things happening in their body through pregnancies or whatever other weird crap they got going on inside their body. So women tend to tolerate things better. But here's the deal: if it hurts a little bit, who cares? You're gonna get a waistline. You're gonna get the body that you want. So it's gonna hurt. Everything, there's pain for everything. Whether it's pain of the cost, whether it's pain of the actual procedure, whether it's pain of the recovery, there's pain. If you don't want to do the procedure, there's gonna be pain of working out. There's gonna be pain of diet and exercise and all that comes along with that. There's gonna be pain of how long it takes to get your results. There's pain involved with pretty much everything that you do in life. So like, stop being so stuck on the pain, because the truth is that the results are it's just worth it. So just suck it up and let me suck it out. So this is funny. I'm laughing at myself, because an inside joke with myself. But I always say, if you can suck it up, I'll suck it out. So that's my tagline.
if I go for round 2, will I need new incisions or can you use the old one?
Um, hopefully, when you're talking about round two, you're talking about that you had it done by someone else. But
This is Alicia Martinez.
yeah, so I mean, if you had it treated, if you've been treated by someone else, so we're doing a revision from someone else's work. Um, I can't promise anything on the incisions. If the incisions are placed in the proper place, then I can work with them. But like if they didn't get good results because of the placement of their access holes, then it would be stupid for me to try to go through the same holes and struggle with the same issues that they had and got poor results because of that. So these holes are tiny. The incision points are so small. I can't remember the last time I had any complaints on the scars. So they heal up really well. Let's see, Kathy Epler, you're asking about compression garments. Where do you buy and how long do you wear them after the surgery? So we do supply compression garments. However, you can get compression garments pretty much anywhere on the, Amazon is like the best place, right? You can get anything on Amazon. But any department stores, Spanx, Fajas is a brand.
She said
Um,
she got it from you.
she got the procedure from me.
Alicia Martinez, I did it from
Okay.
you.
Yes, I'm come get your consultation. I can't talk about details online, so I don't know exactly what we're talking about. Uh, let's see, compression garments. Okay, so how long do you wear the compression garments? So I'm actually considering changing my recommendations. The recommendations at this point were wearing the compression garments for 2 weeks, but I've been recommending that people wear it longer, and I think that people get better results when they wear it longer. So particularly if you continue to have quite a bit of swelling after the procedure, the wearing the compression garments longer would be beneficial for you. So, and the more compression you have, the better. So we do supply compression garments, but having multiple compression garments puts more compression on the area and reduces the amount of swelling. Arletta Austin, is the 360 considered one area? That would be fantastic for you, I'm sure. No, the 360 is liposuction all the way around the waistline, and it depends on what you need. If you're 300 pounds, you're going to need more areas treated than someone that's 100 pounds. So again, the next step is getting your free consultation. So call our office, go to our website, click on the links to get free consultations. And in the free consultations, we'll give you an idea of how many areas you need, which areas you need, and how we can do those. Let's see how much it is. So any of these cost questions that you guys are asking, I'm going to keep referring back to. The next step is getting your consultation, because I don't know exactly what you need. So our procedures are anywhere from 2,500 to 15,000. So it just depends on what you need treated, how much you need treated. We have liposuction, it's $12.99 per area, so it depends on how many areas you need treated. We have fat transfer, which is you're taking the fat from one area and transferring it to the butt or the breast or the face or the hands. That cost is $2,000 per area. And we also do laser skin tightening. So if you're concerned with looseness of the skin and you want to get the best skin tightening after the procedure, Smart Lipo is $650 per area. So, all these costs, they add up. It just depends on what you need. If you want the bare bones, just liposuction of, one area, two areas, it's, you can get it for fairly cheap. But if you want all the stuff with fat transfer and skin tightening and liposuction of 360 or 5, 6, 7 whatever areas, it can get expensive. So again, I don't know what you particularly need. So your next step is to get that free consultation, and in the free consultation we'll evaluate your specific situation, and we'll give you a quote on the areas that we believe that would, if you treated, you would get the best possible results. You make the choice. You can either go with the option that we are offering as far as how many areas to treat, or if you want to treat less, it's your body. We can do whatever you want. So I'm very flexible. I don't push people into anything. Do whatever you want. My recommendations are to do the stuff that's going to get you the best possible results. But with that said, some people are on a budget and they can't afford, the best possible results. So Some people get less than ideal, and or perhaps they just want the sides treated to get the hourglass figure, or they just want the front treated because they're tired of their belly hanging down in the front. So I'm not sure what you need, what you want. Do the consultation.
Instagram asks, how long after giving birth can I have liposuction?
How long after birth can you get liposuction? So the standard recommendation is 6 months. Um, and the truth is you could probably do it sooner. But from my experience, women that are breastfeeding or just had a baby, they have hormones circulating through their body, which changes the composition of the fat and the connective tissue, which actually makes it more difficult to get the fat out. So, and I've had a couple circumstances like this that it was very challenging for me, and I was limited because of that. So I would stick to the 6 months post pregnancy. I think that's ideal.
Yeah, see pictures of big. There's a big person.
Hey Nicolada, I'm so doing the 360. I hope you guys get this. Like I can't say enough about this. Like the 360 lipo is freaking amazing. Like it's amazing. I mean, you look at this lady here with her lower back. Like she has a like accentuated lower back now, and it's such an arch that it makes it look like her butt's popping out, and we didn't do anything to her butt. There's no additional fat, no Brazilian butt lift, no fat transfer, nothing. This is just liposuction. And in her particular, it was sucking the fat out of the lower back that made it look like this. And I mean, it's awesome. I can't speak enough about it. Even men. I just did a man today, and we did 360 lipo, and it's like it just makes you look more natural. I mean, you're not supposed to have fat in your lower back. You're just not supposed to. It doesn't look right. It looks weird. So and I'm not trying to make anybody feel bad. Look, here's the thing. I change people's bodies for a living, so when you come here, I'm able to talk about these problems that you have, and in most circumstances, these are taboo. You're not supposed to talk about these things. You're never supposed to ask a girl how much she weighs, but like this is what I do for a living. So I apologize if I'm a little crass or rough around the edges about talking. I tell people the way it is. And so I'm a straight shooter. I'm going to tell you the issues that you have, and I'm going to tell you how to solve those problems. So I'm not just telling you that you have problems. I'm going to try to fix it for you. So that's how I roll.
On a YouTube, do you recommend someone with skin that forms keloids to do this procedure?
Huh, that's a good question. So the question is, do I recommend someone with skin that forms keloids to do this procedure? So keloids, for some of you who don't know what that is keloids is it's an overabundance of scar tissue, that some people form more scar tissue than other people, and this is more obvious on the outer surface. So like on your skin, if you get a cut, sometimes the keloid will be big and purple and raised. Tends to be much more common with black individuals for some reason. A good example. Okay, so when people go to, you may have seen like these guys they have like fraternities, and they get like branded and they burn them, and it is like a big scar, like the big purple raised scar. So that's kind of what a keloid looks like. So do I recommend it? There's no right answer. The truth is like there's no, like if you keloid, you're not dying. And there are potential treatments for keloids through steroids and stuff. Um, it's a risk that you take. I know some individuals that do keloid, they don't always keloid. So, you just never know. Also, the other thing to consider is with liposuction, the incision points they're literally, they're 2 millimeters. They're so small. So even if you do keloid, you're gonna have just a bigger bump. And while it may not be appealing, you have to decide for yourself what's worth it to you. If for a lot of people, they'd rather get the fat out and have a little bump on their skin than have the fat. So that's up to you. Cool picture. Got to sit back for that. So this is, I mean, this is what I'm talking about, lowering the waistline and elongating that hourglass figure. So you can see how she kind of has that muffining top at the waistline where her underwear are sitting. And so that it's your waist is not supposed to come out like that. It's supposed to go in, right where her underwear are setting. So, and this was this fat transfer as well?
Yeah,
Okay,
yeah,
so this
we
was,
wanted to see the BBL.
yeah, so this is liposuction with fat transfer. So you can see that it's, just trying to sit back so you guys can see this well. You can see in the before picture with the butt, it wasn't, it was much more narrow. And so I was able to get some volume on the outer portion of the butt to create a more rounder look to it. Then this is also a treatment of the liposuction of the love handles and the hips as well as the lower back to create that hourglass figure with the shaping of the upper portion of the butt. So the BBL, the Brazilian butt lift, is it's a combination of liposuction and fat transfer. And so the liposuction helps me to carve out the surrounding areas around the butt. So that's in the upper portion, in the lower back, and the love handles and hips areas. I mean, just like beautiful body. It's amazing. I like this, and so in the Brazilian butt lift, it's just in the after photo, it's just like it looks like nice and perky. And I can put more fat on the outer portion to round it out, and a lot of women have this like straight, narrow butt, so we can get little bit more roundness to it. And then through liposuction, I can carve out the upper portion of the butt and create the transitions and make it look like this. I mean, this is not easy, and you can't just go anywhere to get this kind of stuff done. I mean, you can go anywhere, you're just not going to get the results like this. But um, this takes a lot of patience, a lot of time, a lot of practice. And I've been doing this for a long time, thousands and thousands of procedures. Um, I'm reading this book right now called Outliers, and one of the things they're talking about is how people to master a skill, you have to become one of these outliers, these people that do amazing things. Is that you have to spend about 10,000 hours doing something, like training on your skill, whether like if you're a professional athlete, these kids that start young, the ones that are able to put in 10,000 hours of training by the time they're 20 are usually the ones that go pro. The funny thing is that they couldn't find people that made it to the high levels that didn't do 10,000 hours. So, there's something to be said about that. And here's a little food for thought. Any of these plastic surgeons that are doing liposuction, it's only one small portion of their business, which means that they're doing a lot of other things and they only spend a small portion of time on liposuction. So what that means to me is that they never get 10,000 hours. There's no way. First of all, they're not the volume that they're doing for liposuction procedures is not high enough. They're not doing it often enough. They're not practicing enough to master the skill. I mean, even if these guys are, I mean, like literally, a lot of these guys are, they may be hitting their 10,000 hours when they're like 80 years old or 70 years old, and so, it's not good enough. You can't like do things once in a while. If you want to master something, you have to do it consistently, and you have to put in the time, put in the hours, put in the work, and it's something that I've done. I've been very fortunate. To have the opportunity to treat so many patients. Because to be honest with you, it's hard going from when you learn how to do something like this. It's the critical period that you're like your first like 500 to 1,000 patients is it's the critical period in where you're not really that good and you can make mistakes. Okay, so when you make mistakes, that's when you get stuff like bad reviews, lawsuits, stuff like that. So the first 500 to 1,000 patients is a very critical time period, and if you screw up during that time period, that's when these guys go out of business. So you'll see these doctors or whatever these companies go, they come out, they are in business, and then all of a sudden a year or two later they're out of business. Well, usually they're just not good enough, and when you're not good enough, you end up getting bad reviews, lawsuits, or I mean, simply nobody wants to come to you because you don't have, the proof, the photographs, the before and after photos. So I've had the opportunity to focus specifically on liposuction. All I do is liposuction all day long. For many years, I was doing, 5 days a week. I was doing like 6, 7 procedures a day. I mean, like tons and tons of experience in a condensed period of time. Um, and it allowed me to master it, and it's given me the confidence. And I mean, I'm sure you can tell the way I speak about it. It's um, like I'm good at what I do, and I'm not trying to like brag about it, but it's just I've done so many of these things. It's just like second nature to me. I've created the muscle memory. It's just like think like a pitcher in baseball. If you've gone through that same motion 10,000 times, it's natural. You build up the muscle memory, and it's like you don't even have to think about it. You just do it. Your muscles do what you train to do, and you got to put in the time.
Here's a new one. Do you do fat transfer to the hips and legs? I don't know why they would want it.
Yeah. So the question is, do you do that transfer to the hips and the legs? And Ron says, I don't know why they would want that. But so people use fat transfer for, commonly we're doing it for Brazilian butt lifts or, enhancement of the breasts. So that's the common reason. But it's a filler, so it's a natural filler. You can fill in any gap. So if an individual had like a traumatic experience, and you can get atrophy or the fat dies in some areas, so you get indentations. So yeah, we can fill in those areas like that. If you're talking about the thighs, like you want wider to the butt, yeah, we can do that. You can transfer fat to anywhere. It's a filler. You can transfer it to anywhere you want. It's just just get creative. We just market the butt and the breast because that's what's most common. But I'm flexible. I can do anything. I've done this stuff thousands of times. I can transfer fat to your toes if you want me to transfer to your
That's
toes.
the next question. So do you think that you need more time on practice on BBL because you do more lipo?
No, I do lots of fat transfers. But you're right. I mean, it is. I'll be honest with you. I'm still constantly learning, improving, and getting better. But with that said, I've probably done about, I'd say, close to 1,000 fat transfers, probably maybe more. But I'm still getting better. As I said, I just started doing the liposuction to the lower backs, and I mean they're freaking amazing. The results are phenomenal. I'm so happy with those results. But I'm constantly trying to improve. For me, it's like I'm more focused on the small details now that a lot of other doctors don't even think about. But I've mastered the skill of doing all the other basic techniques of liposuction, and now I'm more focused on trying to get the smoothest transitions and the most natural results, being as aggressive as possible while getting the smooth, even. I'm just trying to perfect my skill, and it's a constant improvement. I'm constantly trying to get better. Each individual is a little bit different. Each individual has a little bit different demands and needs. So, it's an ongoing process, and you can only ask for me to do my best for you. That's all you can ask for. I can't guarantee anything. I'm just going to do the best that I can do.
This person has asked this 3 times.
Uh huh.
How reliable is fat transfer to the breast?
Okay, the question was, how reliable is fat transfer to the breast? I'm going to reword that because I think that what you mean is like, how long will the fat last, and how much fat do we transfer when we transfer? How much of the fat survives? So statistically speaking, the studies show that approximately 50% of the fat that we transfer will actually survive for the long term. Now, once the fat is accepted on your body and survives, theoretically, it accepts the fat cells and creates the new blood supply to feed those fat cells. Those fat cells, they were yours to start with, and they're yours afterwards. And so once your body has accepted into that area, they're there forever, theoretically. Now, I don't know I haven't heard anything to the contrary. So and when I say theoretically, is like because I haven't done the studies myself, so I don't really know. But from my experience and from what the current studies say, is that it's permanent. Now, with that said, all these things, and no matter whether you're talking to me or anyone else, medicine is constantly changing. And you may not realize this, but and you're like you hear this all the time. It's the practice of medicine, and it is simply a practice because it's constantly changing. When I went to school, all the medications are completely different now. They're like they've all changed. How they work changes. The recommendations for medications have changes. And medications that we were once recommending in the past, now we're not allowed to. We're not allowed to use them anymore because they kill people. So I mean, like, medicine is constantly changing, and it's important as a practitioner to continue to practice and improve our skills. So, that's the way that stuff works.
What's the question? Does fat transfer get rid of the dimples in the booty?
Does fat transfer get rid of the dimples in the booty? Okay, so okay. Oh, and another thing. So let me just finish off with this. With the fat transfer, the studies say 50% of the fat cells survive, and like how long does it last is typically, if whatever survives is typically forever. Now, with that said, that was statistics. That was what the studies show. Now, with my experience, I've seen some patients that say that they accept and keep all the fat, and other people say they lose a majority of it. Now, here's the thing that we don't know. This is the variable, is that I don't know what you do when you leave my office. And so we have rules that, you're not supposed to put pressure on the area. So, sitting becomes a challenge. If you're not supposed to put pressure on the area, then you can't sit. That's a challenge. So some people don't follow those rules. So if you don't follow the rules and you don't get the results that you're expecting, that's not my fault. My job is to put the fat in, and take the fat out from the liposuction and put the fat into the butt. That's my job. Once you leave my office, it's all on you. And so you can't blame bad results because you didn't follow directions. But a lot of people love to do that, and leave negative reviews, and talk bad, tell other people, oh, fat transfer doesn't work, when they never didn't follow the rules. Fat transfer absolutely works 100%. It's an amazing procedure. Will it work for you? You got to take a little bit of risk here. It's going to work better for some people than others, but there's things that you can do. We're gonna set you up to get the best possible results, and then you got to take it from there. There's someone asking about the consultation. They're from Ohio, and do we do the consultations over the phone? You don't have, if you're from out of state. I was Lashunda. You don't have to come to our office. We do the consultations over the phone. So she said, I know that sounds like a crazy. It's not a crazy question. In fact, about 70% of our patients are flying in from out of state. So the majority of our patients are doing their consultations over the phone. So we got about 2 minutes left of this.
Okay. Trying to answer all the little.
Yeah. And so anybody who's got questions about the cost, you got to get your consultation to figure out what you need treated, for us to answer anything about cost. And obviously, I'm not seeing anyone on here. I'm looking at myself. So schedule your consultation, and also the contest that we're running right now. We're offering 3 areas of liposuction for free. Excuse me. To enter the contest, you have to place your deposit for your procedure. Once you place your deposit, you'll be entered into a pool, which will be very limited to only the people that have placed their deposits or had their procedures within this 3-month period. So every quarter, we're going to announce a new winner. So we're trying to incentivize people to get in there and just place their deposit, and you're going to have a good chance of winning. This is much better than our previous contest, where we were just randomly selecting anybody who entered. With that contest, we have nearly 100,000 people that have entered the contest, and so you're like 1 in 100,000 chance of winning. Whereas this contest, you're going to have about a 1 in 100 chance. So it's substantially better, which is pretty cool. And I want to encourage people that are going to support me. So that's kind of why we're doing this. How long will you have to stay over after the procedure? So if you're flying in from out of state, typically I recommend flying in the night before. Come to your procedure the next day. Spend the night of your procedure. Spend the night in a hotel. Then if you wanted to leave the following day, you can. Otherwise, staying an extra day would probably be beneficial. All right, so we're done on Instagram. All right. I'll answer some other quick questions here on Facebook before I call it a day. Let's see. Someone says, "Can this be done on your face to get rid of your double chin, fatness on the neck and cheeks?" Yes. Fernanda Torres. Yes, it can absolutely be done on your face. We call it the chin. So the chin area is actually going to go from above the jawline here, and then everything else in the neck. So a lot of people, you're concerned about, your profile view when you turn to the side, you have this double chin. So that'll be taken away, but we also take the fat above the jawline. So ideally what we're doing is trying to create that jawline for you. A lot of people, it's like your face goes right into your neck. And so we just need to create the jawline to give you, a better profile. But it's an awesome procedure. So if you have that issue, it's so easy. It's literally, it'll take me a half hour and you'll get your jawline back. Something that's probably been evading you for decades. What's up, Kevin Hoffman? Let's see. Kathy Epler. Kathy Epler, I can tell by your questions that you've been looking into plastic surgery for a while. So I do things differently, Kathy. I'm not a plastic surgeon. I'm not bound by the rules that they live by. So we don't use drain tubes. Those things are just nasty, and I couldn't imagine having a tube sticking out of my body after a procedure. Every time you walk around, you're worried about it getting ripped out. So those suck. So we don't do tubes. Those drain tubes, the purpose of the drain tubes is to get the fluid out of the inside portion of your body. So we leave the holes open. So they're tiny little puncture holes, 2 millimeter puncture holes. Those holes are left open, and typically the lower holes are where you would drain fluid. We cover these with super absorbent pads, which will collect the fluid. And typically people will drain for about 3 days after the procedure. Doing it this way, it eliminates those drain tubes, obviously, but it typically will allow you to get more drainage out. The compression of the garment actually forces the fluid out. Now, downside, it can be a little bit messier because the drainage, the fluid comes out, and it can, if the pads move, it can get over, it can make a mess of your clothes and things of that nature. But from my experience, it's so much better. I'd say very, very small percentage of people really don't like that because of the drainage, but you got to cater to the mass of people, not the minority. You guys see any other questions?
I have a 5-hour drive back after the procedure. Will I have to stop and walk around?
Okay, so the question was, I have a 5-hour drive back after my procedure. Will I have to stop and walk around? So yes, after any procedures, you're at a higher risk for blood clots. So blood clots form when you're sedentary in nature. So if you're sitting for an extended period of time, like whether that's on a plane or a car, you definitely want to walk around regularly, and that'll reduce your risk for blood clots. See, someone asked here about, have you ever done the part where the C-section is? Yes, absolutely. This is probably one of the most common things I do. Most women who have had C-sections, the belly folds over at that C-section scar because of the adhesions from the scar. So we can definitely, once you reduce the fat, the belly becomes flat, and then I can also I can undermine the scar tissue from the C-section scar, which will allow that to pop up a little bit and become more flat as well. So I got some cool tricks. So if you have a C-section scar, just come check it out.
Do lymphatic therapy after the procedure?
So the question was, do you have doing lymphatic drainage or lymphatic massages after the procedure, is that beneficial? Yes, it is. I don't officially recommend it, but I don't, if you want to get it, I've heard good things about it, but it's definitely not mandatory. But a lot of people say that they like it and they've gotten better results, they believe, because of it. So absolutely, if you want to do that, I recommend trying. Joanne Marie, how much per area? We charge $12.99 per area. To figure out how many areas you want and get an accurate quote, just schedule your free consultation.
Facebook is, I mean, YouTube is asking for a number.
YouTube?
Yes.
So our phone number is 702-818-5476. If you missed that, go to our website, myshapelipo.com. It should be in our profile. Or if you go search liposuction, you'll find us. I really appreciate you, Rachel. I see you answering questions. That's awesome. Hope you guys are listening. Rachel's been around for a long time. Okay. Any other questions? I'm getting tired.
Yeah, most are asking for prices.
Okay. Yeah, any of your pricing stuff, you want to get your consultation.
No credit. But we have a financing company, right?
Yeah, so we don't do care credit, but we do have a finance company that we deal with.
Can you eat before the procedure?
So the question is, can you eat before the procedure? The answer is yes. The reason why you wouldn't be able to eat before any of these procedures is if you're having general anesthesia. So if you're going with a plastic surgeon that's putting you to sleep, general anesthesia, you can't eat before, but since we don't use general anesthesia, you can eat whatever you want. And in fact, I encourage you to eat because we use oral medications and you can get nauseous when you don't have anything in your belly. This is Angelica, or Candy Lover 89. She had just liposuction. So this is a 360 lipo, which included the lower back. And we did not do fat transfer to the butt. So this is kind of an optical illusion here where it appears that her butt is sticking out further. But the reason why it appears that her butt is sticking out further is because we treated lower back. So she's got more arch to her lower back. And you can see how nice that transition is from her lower back to her butt. So that's that's what I've been improving. That's what I've been getting better at, is improving those transitions, and I work hard to try and make everything as smooth and even as possible.
Do you do lipo around the pubic area, the pubis?
Yeah. So the question was, do we do liposuction on the pubic area? I know some women call that the fupa. Fupa. I hope I said that right. It stands for something. I'm not going to say it, but yeah. So I do, I do liposuction from anywhere. If you have if you have fat, on your pubic area around your genitals, we can get the fat away from there safely. If you have fat on the back of your back, we call this the buffalo hump. So this part back here, so it looks like you're like hunched over. You know what I'm talking about if you have that problem. That's something that's an easy fix. So, these individuals, it's got to be like you got to have such insecurity. I can imagine, walking around and you have this like hunched back, and it's got to be so, like, man, I couldn't imagine. But anyways, it's a quick and easy fix. So if you've been walking around like that your whole life and you've been embarrassed, it's an easy fix. If you've had a double chin, it's an easy fix. If you got big arms, it's an easy fix. You got a big belly, or you're square in the waistline, you have no curves. These are all easy. All this stuff is easy for me. It's very rare that I've had a challenging procedure the last couple of years. I've seen so many different things. It's like, it's the same things over and over, which is good for you, because I've gotten really good at all this stuff. Okay. See, Amanda says, can you be put to sleep? You can. You just can't have that here. So plastic surgeons do that. So if you're looking to be put to sleep, you should go to a plastic surgeon. They still do it the old way. And just so you're aware, that's the old way of doing liposuction. And also, this is kind of people believe that when you're put to sleep, that it's just like going to sleep in your bed, and it's not like that at all. They give you medications, drugs that stop you from breathing and give you amnesia. So you don't remember anything, and it stops you from breathing, and they have to put a tube down your throat and put you on a breathing machine. So that's what happens when you're put to sleep. Because of that, it's extremely dangerous. All the major complications that I have researched and found for liposuction, all of them have come under general anesthesia and from plastic surgeons. So if you choose to do that way, go to a plastic surgeon, make sure that they have had plenty of experience, check their track record, talk to their previous patients. But with that said, it's kind of a crapshoot. You never know. Um, General anesthesia is probably the cause of the majority of surgical problems. So, personally, I would try to avoid general anesthesia like the plague. And I would say the same thing to any of my family members. Um, but I know there's people now that are just they allow fear to dictate their life, and the fear of discomfort and pain will push you to do stupid things. And in my opinion, getting any procedure under general anesthesia, if it can be done uh, without general anesthesia, it's a stupid decision to do general anesthesia. All right. Okay, so someone's asking, where do I stay if I come out here? So we used to have an affiliation with a local hotel, and we would get discount deals for our patients because we had a lot of people flying in from out of state, so it was we got bulk discounts. The problem with that was that our patients they would go to this hotel and they would make a mess, and they would damage the facilities because of the drainage of their fluid. They wouldn't take care of themselves, despite the fact that we gave them all the supplies. We gave them we give all of our patients a plastic sheet to put on your bed. So whether it's your bed or the hotel's bed, we want you to protect your bed. But some people don't follow directions, and unfortunately, too many of them did. The hotel had many damaged beds and sheets and carpets, and heck, I mean, they were even saying they got on curtains and stuff, which is crazy. But people do what they do, and it's I can only control what I do, and I can only control what happens in front of me in my office. When you leave the office, I don't control that. So, anyways, long story short, we don't have an affiliate with the hotel, but there is a local hotel. I think the Best Western is the closest one to us, and they actually do transportation where they'll drive you. They have the free transportation within 5 miles, so they have a shuttle that they'll bring you to our office and pick you up. But obviously nowadays you can do Uber, which makes things really easy. But this is Vegas, so there's lots of hotels. They're all over the place. And it just depends on what experience that you want. There's a hotel within 1.5 miles from our office, which is very close, obviously. The Las Vegas Strip is about 15 minutes away, so if you want to do the whole casino experience. There's also casinos that are off the Strip that are more for local individuals, and in my opinion, they're much cleaner. They smell better. They don't have all there's fewer smoking issues, and I think they have better ventilation. Green Valley Ranch is one of them.
After you lipo an area, is the skin loose?
So the question is, after you lipo an area, is the skin loose? So everyone's different, and it kind of depends on how you start. But you can see. Is this a good one? Yeah. Yeah, you're trying to zoom in. So you guys I know you guys may not be able to see this, but this young lady first of all, she's got a C-section. You can see in the after photo, she has a C-section scar, and then she also has multiple stretch marks. So she obviously had a baby, at least one baby, probably multiple, where she had many stretch marks and looseness of the skin, and then she has that C-section scar that people are concerned about. Now, if you notice, Now, first of all, we have a black box that's covering our genitals, which is very close to that C-section scar, but you can't see the C-section scar in the before picture because it's folded over. So the skin folded over her C-section scar, and afterwards, now you can see where the C-section scar is because the belly is now flat. So the skin retracts back quite nicely for most individuals. With that said, everyone's different. Some people have looser skin than other people. Some people have the natural healing capacity to tighten up their skin better than other people do. That's not something that I control. My job is to get the fat out of you and get you as smooth and even as possible and get you set up for the best possible chance of getting excellent results. Now, a lot of that's only one component of results. The other component is you're going to have your natural ability, your body's own natural ability to heal is different than someone else. What you started with is going to be different than someone else. So if you had looser skin, or if you're much larger, you had stretch marks, you had dimpling, all these things are going to contribute to the way that your results are going to turn out afterwards, which it makes it different than someone else. It's always going to be just a little bit different.
This isn't right. It says the website says that 1,900 per area, but you're saying 1,299.
Pull up the website. I don't think it says that. So someone said that the website says it says 1,900 per area. No, it doesn't say that. So liposuction with the smart lipo maybe is 1,950. So the liposuction is a removal of fat, and the smart lipo is a laser skin tightening, and the laser skin tightening is $650 per area. Liposuction is $1,299 per area. So combined together, it's $1,950 per area. So if you want the skin tightening with the liposuction.
What if I take meds for high blood pressure?
The question is, what if I take meds for high blood pressure? Yeah, so that doesn't make any difference. As long as your blood pressure is controlled, that's fine. If you come into our office and you have higher blood pressure, I give you medication anyhow.
Yeah, she said it does. 1949 with smart lipo.
Yeah, with smart lipo. Yeah. Yeah, so I mean, look, there's cost to things. There's costs. So it depends on what you want. If you don't want smart lipo, it's $1,299 per area for liposuction. If you do want smart lipo, you want tighter skin, then you're going to pay for the extra service. If you want fat transfer, you're going to pay for that service. Like, it is what it is. Lisa Gomez asks, hello, if she's diabetic, can you get lipo? And the answer is yes. You can get liposuction if you're diabetic. We just need to make sure that you're medically cleared. So whoever treats you for your diabetes, we want to get you cleared medically through them. And ultimately they're going to run a test called the hemoglobin A1C, which shows how well you've been controlled over the course of, I believe it's 3 months. So, I see people, again, they keep asking about costs. You got to get the consultation. And look, the costs, we're flexible, and you can do this cheaper, or you can spend more money. This is just like buying a car. If you go buy a car and you want to get the car with a nicer paint job, it's going to cost more money. You want to get the car with the truck with the raised shocks, like that costs more money. You want to get the automatic windows versus the windows that you roll up like that, it costs more money. You want a nicer stereo, costs more money. Same thing with liposuction. Liposuction is one cost. If you want to get the skin tightened, it's going to be a little bit more money. You want to get fat transfers, it's going to be a little bit more money. And you want to get a lot of stuff done, it's going to be a lot of money. I mean, it's just it is what it is. But if you go somewhere else, it's going to be a hell of a lot more money. So I mean, you got to keep things in perspective here. There's other people that are charging twice as much as what I charge, and they have like a quarter of the experience. So really, the value that you're getting is phenomenal. So I mean, you guys can cut me about price, but it is what it is.
Would I need to have someone come with me for after the procedure to help me?
The question was, would I need to have someone come with me after the procedure to help out? So this is, I guess, a controversial subject. I recommend having someone with you. That's my official recommendation. With that said, there's lots of people that do it without having other people with them. in my opinion, you're just it's more difficult. It puts you there's higher risk when you don't have help because say you get a lot of areas treated, you're sore, you're achy, maybe you took medication, so you're a little drowsy, and you're draining all this fluid. Um, having someone to help is just it's beneficial. But I know there's some people that they don't tell anybody. They're flying in from out of state, and they don't want anybody to know, or no one's able to come with them, or they're trying to do it as cheap as possible. So like there's lots of ways you can do this. Doesn't make it the right way. Just because it's possible doesn't make it right. um, but everybody makes their own choices. So I'm going to recommend doing things the best way. And if you want to cut corners, you want to do things differently on your own, then that's up to you. But I'm trying to get the best results for you, and I'm trying to have the best experience for you. Let's see. Any other questions?
Not really answerable. They're mostly price.
Okay. All right, guys. Well, kind of tired. Gotta get home to my family. I hope you guys got a lot out of this. I really appreciate each of you for jumping on live with me. I do appreciate this. It makes me feel like I'm actually doing this for a reason, because I hate doing things and wasting my time. So I appreciate each of you jumping on here and asking questions, giving me the opportunity to answer these for you. And I hope that helped. So again, just to reiterate, if you're ready to get this going, you're ready to change your life, you're ready to get that hourglass figure, get smaller. The next step is getting your free consultation. The consultations can be done in person if you're local here, or if you're from out of state, as most of our patients are. We do our consultations over the phone with pictures. So you can call our office, go to our website, myshapelipo.com, click on the links down below. Hopefully we have some links down there where you can click. But step up your game. You don't have to feel bad anymore. You don't have to feel a certain way because like you're embarrassed about the way that you look. Like, just do what you got to do. Do what's necessary to feel the way that you want to feel. And if liposuction can help you look the way that you want to look and help you feel the way that you want to feel, then it's worth it. You can't really put a value on those type of things. So thank you guys for watching. I appreciate you again, and I'll probably be back next week live again. All right. Hope you have a great day.